Hello, and thank you for joining the American Journal of Managed Care's Oncology Stakeholder Summit, Spring 2017 Peer Exchange. Many changes have been made within the FDA surrounding off-label communication and the management of newer cancer agents and their costs. While innovative trial designs have led to the promise of a boost in emerging agents for the treatment of various cancers, provisions within the Affordable Care Act have had a significant impact on costs and patient care. In this peer exchange, our panel of experts will provide an overview of the FDA changes and address the promise of increased patient access and a more personalized approach to further ensure patient-centered care. The panelists will also address how the Affordable Care Act will continue to affect the delivery of patient care and coverage. My name is Dr. Joseph Alvarnas, and I'm the Director of Value-Based Analytics, an Associate Clinical Professor in the Department of Hematology and Hematopoietic Cell Transplant. I also serve as the Clinical Quality Director of the Act One Clinic at the City of Hope Comprehensive Cancer Center in Duarte, California. I'm also the Editor-in-Chief of AJMC's Evidence-Based Oncology. Joining our distinguished panel to share their perspectives are Dr. Robert Carlson, Chief Executive Officer for the National Comprehensive Cancer Network in Fort Washington, Pennsylvania. Elizabeth Carpenter, Senior Vice President of Avalere Health in Washington, D.C. Dr. John Fox, Associate Chief Medical Officer for Priority Health in Grand Rapids, Michigan. And joining us later will be Dr. Bhuvana Sagar, National Medical Director at Cigna Healthcare in Houston, Texas. And joining us remotely for this panel will be Dr. J. Leonard Lichtenfield, Deputy Chief Medical Officer for the American Cancer Society Incorporated in Atlanta, Georgia. Start talking about changes within the FDA. So with respect to off-label communications, Bob, how does the FDA define the scope of off-label communications? What is the level of evidence that can be included in this communication, and how can payers use this information?
Well, the FDA sort of broadly defines or looks at off-label communication as first healthcare economic information, and that may relate to the labeled indication, but looks at economic analyses of the use of that drug in that labeled indication, often in comparison to other agents or potentially no treatment. And that's the sort of information that might be of great interest to pharmacy and therapeutics committees, to payers, probably less so to practicing physicians or patients as such. And then, of course, there are the off-labeled indications. Those are the uses of the drug for which there is a label, but using them in circumstances or situations where the drug is active, presumably, but not actually on the label. And in doing that, the FDA does have a series of criteria that they look at in terms of what they think might be appropriate off-label communication between the pharmaceutical industry and the provider, payer, patients. The information is required to be scientifically valid. It cannot be false or misleading. And it's an interesting area, both scientifically but also legally, because there are issues of a drug company's First Amendment rights, freedom of speech, freedom of communication with its stakeholders, and yet the FDA wanted to be sure that that communication is appropriate, that it isn't false or misleading, to help to protect the safety of the patient population, and to be sure that the agents are used correctly.
Bob, how are they vetting? How is the FDA vetting that information to ensure the accuracy and validity of the data?
Well, I can't tell you for sure. What I can tell you is that there's enough concern among the pharmaceutical industry in that vetting and what is legal for them to do and so forth, that there isn't a lot of that going on. I think there's very little, for instance, very little information on the healthcare economic information that's being provided to pharmacy and therapeutics committees by industry. And that's because they're afraid they're going to get sued by the FDA or by others.
Yeah.
And I think the same for off-label indications. They're very cautious about providing information off-label. The FDA in their defense, does provide some guidance. It's primarily draft guidance in terms of what that communication should look like. Those communications or things that they hand out are things that should not have been derived primarily by the request of a company. So it can't be an article that is written and funded by industry. And it also needs to be information that is readily available in the public domain and is the sort of information that you would normally buy or obtain where you get other peer-reviewed literature or textbooks, that sort of thing. So it can't be sort of a primary pharmacy drugstore, or a bookstore, if you will. It needs to be more in the public domain.
I guess I have a concern about the health economics data. Almost I can't imagine that there's a pharmaceutical company that exists today that doesn't have a health economics and outcomes research department, and they're all trying to demonstrate the economic benefits of their drugs. And the most common claim is that they'll reduce other costs. If everybody reduced the costs to the degree that they said, healthcare would be free, I think. But I'm also concerned that with the methodology that's being used, especially if we have multiple manufacturers approaching us as a health plan making claims, how can I compare the validity of the methodology and the findings, number one, and number two, given that I can't do that, is there somebody who's better to do that than a pharmaceutical manufacturer? Should it be the government or somebody else who's unbiased and does that health economics outcomes research? So the fact is that companies have these functions today, but I'm not sure that the loosened FDA rules on sharing ER data is going to make the life any better or the information any more credible.
So you think there's an ethical dimension to what we're talking about?
Well, look, I've never seen one of these analyses that didn't support the drug that was being touted, and so everybody is going to embellish the data in a way that makes them look the best. And I'm not saying they're not people of integrity, but that's everybody's desire to make us look better than or as good as we are, or as good as we could be.